This is not about punishment. This is about protection. We cannot have a cohort of people, many of whom, not all, but many of whom, are in poor health to start with. We can't have this virus spread. We have to do everything we can to contain the virus, and that's why staying in your unit, staying in your flat, is absolutely essential. If we have a large group of people who've already got pre-existing and underlying health challenges infected with this virus, then people will die. It is as simple as that. These towers are being treated in a public health response sense no different to an aged care facility, and that is exactly the right way to go.
And the Victorian Premier's press conference is currently continuing in Melbourne. Let's listen in.
That'd be a great outcome. But this is with us, and it's going to be with us for a long time. It is getting it at manageable levels so that, again, it is stabilised, we drive down case numbers, and then we can have some incidence of the virus in the community until we get a vaccine, but at low and manageable levels. Everybody has a stake in that, even those who perhaps aren't taking this seriously. And I think that's a small number, but the message to them is very clear. It is serious, it is real, and we all have a part to play in delivering the National Cabinet strategy to have a small number of cases, but a sustainable number of cases, a controllable number of cases. That's what we're working towards.
For the people that live in these towers who have drug and alcohol dependence issues,
there are, yes, it is pharmacotherapy, methadone and other programs for those who are registered clients, for those who may need that support. There's been a lot of work go on overnight to make sure that we can connect those people with the services that are very important to them, just as mental health support, just like basics, food, all the care, trying to support the kids in the towers as well, giving them things to keep them occupied and busy right across the board. We are every hour building to our comprehensive list of needs and adding to our comprehensive list of needs within the towers, and then working extremely hard to meet all of those needs. Some of that will take a little bit of time, but we do know and understand how important those pharmacotherapy services are, and they are, as I'm advised, my last report an hour ago was that they've already begun being rolled out.
What training have police officers had to deal with specifically the public housing lockdown?
As you would have seen, there were a large number of Victoria Police out there to guarantee public order and to guarantee the terms of that hard lockdown. I want to make it clear to all of those residents, again, this is not a matter of punishment. This is not a matter so much of law enforcement. It is about delivering the orders that are there to protect you and your family, many of whom, as you well know, have poor health to start with. I'm very confident that both from the Chief Commissioner Shane Patton all the way down to those who are on the ground running this massive police effort, they know and understand full well their obligations and what's required when it comes to limiting the spread of this virus. I'm very confident of that.
But this is the first lockdown of its kind in Australia. What specific training have police officers had so that we don't end up with a similar situation to what we had with the hotel quarantine and security?
Well, what's occurred at hotel quarantine is the subject of an inquiry, and I'll let the inquiry come back with the answers to those questions. I think that Victoria Police are appropriately trained, they are appropriately briefed, they take these matters very seriously. I am reassured by the approach that Shane Patton as the Chief Commissioner is taking, and I've certainly seen no suggestion to the contrary. Each and every member of Victoria Police who are deployed in these roles and the many other roles. You've seen the footage, you've in fact filmed the footage and put it to air, and I'm grateful for you. The enforcement activities, checkpoints, booze bus type arrangements in lockdown suburbs, police are taking this very seriously, masks, gloves, all those sorts of usual processes. I have no doubt that every member of Victoria Police who's engaged in this work across the state, no matter what that work might look like, know and understand that they can't be contributing to the spread of this virus.
Can you confirm that Qantas and Jet staff are being trained then?
Sorry?
Can you confirm that Qantas and Jet staff are being trained to be rolled out in the quarantine hotels? And if so, how are they expected to be more successful than security guards?
Oh, I've got no announcements to make in relation to hotel quarantine other than to say to you that Corrections Victoria, there's a reset to this program, and Corrections Victoria have the lead, and I think they are the best qualified people to do this important work. After all, They run our jails. They know exactly how to deal with complex and challenging environments, and that's exactly why they are in charge.
How much notice was given to police last night?
We were in conversations with Victoria Police throughout yesterday, and I'm very grateful to the Chief Commissioner and to others who are central to this important work, particularly Commander Mick Herman, who, as I said yesterday, is well known to many Victorians, if not by name, then certainly by his leadership during the bushfires over summer, where he coordinated the evacuation of, I think, in the order of 80,000 people. He knows he's exactly the right person to be doing this. He'll be supported by a large team of others, but Victoria Police have done an outstanding job, and they will continue to.
Can you give us a breakdown of just how many police are working at these towers, how many nurses are there, how many people are actually in?
I think I might probably be best if I came back to you with a bit more of that detail. That's pretty fluid and changing, and I think you'll see those numbers grow. My last advice is that from a police point of view, it's at least 500 per shift, and it's a combination of those who are securing the perimeter of these towers, as well as police on each floor, who are essentially monitoring and making sure that people are compliant and are staying in their home, not using shared spaces. So beyond that, it's probably best if I get some further detail and provide you with the most contemporary and the most accurate answer to your question.
Brad, just before we ask Brad, with hotel quarantine, people were allowed out once a day to get some fresh air. Are we going to see a similar thing with public housing tenants, given you've got overcrowding in some, you've got parents with lots of kids, and you've got people with pets?
That is not settled at this point. We'll look to try and find a safe way to do that. It is possible that there is no safe way to do that en masse, and therefore we'll have a localised response. I'm afraid I can't give you a definitive answer to that question. The key point here is to make sure that the conduct of everybody across these towers, both those who live there, those who are working there to support each resident, and those who are securing and delivering the order, making sure that it actually works, do nothing whatsoever to contribute to the spread of this virus. I can't give you a definitive answer on that issue, but it's one that we are working through with leaders in each of these towers, those who speak for other residents, and indeed on a very personal and individual level.
Who is overseeing the program? I know you're obviously the leader of the government, but which ministers or which bodies are the ones kind of making day-to-day judgment calls on how it's going to develop?
There was a CCC meeting yesterday afternoon to confirm these arrangements before they were put in place. There will be, as there has been right throughout the pandemic, a mixture of that crisis council as well as full cabinet, principally from a coordination point of view. Minister Wynne, as the housing minister, will have the lead when it comes to particularly the support services, trying to coordinate that into one place across government. I think that makes perfect sense. You had something for Brett, yeah?
If that's all right, if we could just ask Brett the
sure, no worries.
breakdown of the amount of new cases within the public housing buildings.
Sure.